The 2018 Health and Wellness Coach Recognition Resolution has been introduced, and we would love your co-sponsorship. This year, we have more original co-sponsors than we've ever had before. So thank you all for your work, and let's gain many, many more.
On Tuesday, February 13th, we went down to Washington, D.C. to participate in a luncheon with members of Congress. During this meeting, we met with various staffers. There were about 50 health coaches in the room talking with members of Congress, talking with staffers, and we gave a variety of presentations.
One thing that really caught my attention is that health and wellness issues resonate with the members of Congress and their staffers.
My push to you all is to urge folks like me, urge your member of Congress, your senator, your representative, to really talk about healthcare and placing a greater emphasis on healthcare education in our schools.
And the overall day was about advocating for health coaches, showing the value of health coaching for people looking to change their health.
The science is in that peer coaches are much more likely to get people to adopt and maintain healthy behaviors, not experts.
You can eat all the kale and broccoli in the world, but without addressing the entire individual, you are missing the key components to wellness.
Some of these schools are saying, to heck with detention, we're going to implement meditation and mindfulness. In Baltimore, for example, who have had a massive rate of suspension, they implemented mindfulness and meditation programs, and that rate of suspension dropped to 0.
After the luncheon, we spent the rest of the afternoon into the evening meeting with members of Congress and talking about the value of health coaching.
Most of my clients are actually professionals, medical professionals, public service, people who serve. I serve them.
And I came into health coaching because I have multiple sclerosis. So it led me to IIN, and now I just try to share with everyone that I can how important it is to, work with your doctor, but also to look at other things.
It's not a program where we're replacing your nurses, your social workers, where they're your care treatment providers in that sense. But it's important to know that a health coach can be plugged in a time of need and pull back when it's no longer needed.
One of the things that really resonated well with the members of Congress as well as their staff was the fact that health coaches, they were able to explain how they helped folks, but in their own special way.
And I found that I was able to reverse my multiple sclerosis by managing my stress, by being cognizant of what I was eating and how I was thinking. I see a lot of clients that have gone through chronic illness and they start to question their own sanity. And I know I've been there.
To have someone to talk to relate to your cultural norms and work with you on, we call a holistic need or a primary need, looking at all those things that you don't eat that make you feel better or worse.
They learned that health coaches are uniquely positioned to help out in this health crisis that we have.
We have to have a system in place where there are enough health coaches for unhealthy people.
In Lloyd Doggett's office, we met with one of his staffers, and she was actually sick at the time. And at the end of the meeting, one of our health coaches even gave her a full regimen of what she could do to help with just natural remedies. And she took the note, and later that week, Lloyd Doggett actually participated and signed the resolution.
The dinner was great. It was a chance to unwind after the day's events. It was also a chance for health coaches to come together with members of Congress and talk a little bit more about health and wellness and what it is that health coaches do.
I think there needs to be significant improvement in the way we approach healthcare and the way we dispense it and the way we support people.
There's such food pleasure in Italy, and we don't think about food and the pleasure from it and that component and how we come to the table, right? So how we come to the table is just as important as what's on the table.
There are things that you can do to help support health coaches with members of Congress. If you go to change.org and look for the International Association for Health Coaches petition pages, you will find links and information on how you can help out.
I applaud the work that IN does. I just think health coaching is a huge, pioneering, critical field that has to expand exponentially so that it can reach as many people as possible.